It's a beautiful day. Lucky that we live Hawaii.
24/7, 365.
Swimming in the ocean anytime.
Take a leap.
Live healthy. Eat well. A, be active. P, live mono every day.
Take a little bite.
Aloha kako and welcome. I am Lynn Salamanca of the Women, Infants, and Children program of the Hawaii State Department of Health. I'm really glad to be here as your host for this episode of Foundations for Healthy Generations. It's a program for and about public health issues in Hawaii. Each month, the Hawaii State Department of Health invites you and your friends, family, and community to join us as we discuss public health programs, issues, initiatives, and concerns. In today's episode, we will talk about a communicable disease called hepatitis and how to prevent and control this illness. The identification, monitoring, and control of communicable contagious diseases is a core function of public health. Today, we will hear about how the Hawaii Department of Health is working to control and prevent hepatitis in Hawaii. Our special guest for today is Thaddeus Pham, the Adult Viral Hepatitis Prevention Coordinator of the STD/AIDS Prevention Branch. Welcome.
Thank you so much, Lynn. It's so nice to be here today. And I really appreciate the opportunity to share some of the work that we do in hepatitis and also to talk about hepatitis and raise awareness.
Well, thank you for making time and coming in to talk with us.
Sure.
And as a fellow state employee, I'm curious how you got started and a little bit about your professional and personal background as well.
Well, it's kind of a weird road that I took to get to public health. I originally grew up in California, the wilds of California, and my first love was the ocean, so I went to college to get a degree in marine biology, and I came out to Hawaii to originally work with dolphins. So it was really exciting. I was teaching them a lot and learning a lot about dolphins. And as part of the things that we were doing, we were really kind of seeing how we could relate to them and really kind of got to thinking about how community played a role in interactions with people. So after I worked with them, I moved into veterinary care, worked more with animals, but I kind of realized that I missed humans. So, I got another job. I worked at Borders for a while, and when I was there, I was volunteering a lot, and someone recommended that I apply for a job at Department of Health. I think just seeing my passion for the community and my work. So eventually, I moved over to Department of Health, and I worked with HIV, doing frontline services, working with the community to provide testing, to provide care, and to get them all the other services they need. So that includes STDs, hepatitis, anything that would really help them feel healthier and deal with their disease. So.
Oh, it's very cool. Well, I also understand that you were honored recently or nationally by being selected for the Minority Leadership Program. Congratulations on that.
Oh, thank you. Yeah. So
tell us a little bit more.
Yeah, the National Minority Leadership Program is something that came about 2 years ago, and what they do is they select a handful of people nationwide to represent minorities and who are working in public health and really empower them. And for me, it was really empowering, and I think it's really important because I think public health is about lifting up and empowering communities, really giving people the tools that they need to stay healthy or to be healthy. And so what this program did was it enabled us to connect with other people nationwide who are doing the same kind of work that we're doing, so hepatitis and HIV, and see how we can work together and build projects that affect our local communities but can also be implemented other places, so other jurisdictions, other communities, and how they can thrive together. So. Yeah, it was really great, actually. And I got a free trip out of it.
That's very cool.
DC.
It sounds like you could be a good mentor for some new students who might be either contemplating going into the field of public health, or maybe they're already beginning. What advice might you have for those students?
Be creative, I think. Public health is always changing, and that's what makes it so exciting. It's always a challenge, it's always something new. So really thinking about how to work with communities and how to work with resources that aren't always available. So being creative and being optimistic, I think. sometimes people say I'm a little too cheery, but I think it helps in public health to really look and hope that you can make a difference and that you are making a difference just by doing the work that you're doing. So optimism and creativity, I think, will be a big assets to the work that they do in the future. Yeah.
Very cool.
Yeah.
Well, I think if you could expand a little bit more about your work with the STD/AIDS Prevention Branch, which is under the Communicable Disease Division and the department.
So what is happening now with hepatitis is, even though it does impact a lot of communities, especially in Hawaii, there's not many resources available. So currently, I am the one-man hepatitis team for the state. And what I do in Department of Health, because I am that one-man team and there aren't many resources, is, like I said, reaching out and empowering communities. So building partnerships and identifying ways that I can help people get access to the resources that they need. Someone asked me this one time, and I think the easy way to think about what I do is really raising awareness about hepatitis. So like here, I'm just talking about it, which I love to do, but also raising awareness and increasing access to resources. So increasing access to testing for hepatitis so people know what their status is, increasing access to vaccination so they can stay protected, increasing access to education so they know what hepatitis even is and how they can protect themselves and their families, and also increasing access to care. So how do you get someone who has hepatitis to a doctor? How do you facilitate all that? So that whole gamut is really what I cover. So everything related to hepatitis. So yeah, so that's what I'm currently doing in hepatitis for Hawaii.
Okay. And it sounds like you're just doing a really awesome job of making those connections with the different organizations as well, and then building capacity within the community.
Definitely, yeah.
Now, I get a sense that hepatitis is important. So is it a growing issue then within their state?
Yes, yeah. The most interesting thing is, even though hepatitis, causes more deaths and more illness than HIV now, nationwide and also in Hawaii, not many people know about it. So if you don't mind, I'd like to go over a little bit about the basics of it.
I'd love to hear more about it, yeah.
Okay, great. So hepatitis really affects the liver, and pretty much the liver processes everything that goes to your body, right? So everything you eat, everything you drink, everything you smoke on the weekends, everything you put on your skin to maintain that lustrous quality, all of that is absorbed into your body and is processed through your liver.
It's a pretty awesome filter. Yeah.
Yes, exactly. It's like a little factory that diverts everything where it needs to go, right? So it's really important when this thing is messed up that it can compromise your whole health.
Right.
So what hepatitis can do is it can cause swelling of the liver and it can lead to cancer. So sometimes it can lead to death. Sometimes it requires a liver transplant, but there's a lot of huge health implications that happen if you don't take care of that liver. So with hepatitis, what we found is we have actually the highest rate of liver cancer in Hawaii and across the country.
Oh, wow.
Yeah, and the leading cause is hepatitis B and C. So it is impacting our community, and we really want to make people aware that it is important to know about. Are you aware of the different types of hepatitis? Or?
Well, I think I've been asked before, for testing or if I've tested positive for it, but I'm not fully clear on the differences. So if you could talk more about that, that'd be great.
Sure, yeah. So there's basically two that affect people the most in Hawaii, and that's hepatitis B and C. They're very different viruses, but they just both affect the liver. So with hepatitis B, it's spread mostly from blood or from mother to child, especially in Asia, also in the Pacific Islands, where hepatitis B is much higher. So what happens there, it's not even anything you've done. It's really you just happen to be born in a place, Asia or the Pacific Islands, where there's more Hep B around, right? So a lot of people who live in Hawaii are impacted by Hep B in that way. Again, the things that we can do about it are get tested to make sure you're okay, get vaccinated if you want to get protected, and get to a doctor if you have it, right? So just basic messages. With Hep C, it's a little bit different. Hep C is only spread from blood to blood, so we want to make sure anyone who's exposed to a dirty needle, who's gotten an unsafe tattoo, those people get tested. Also, we've noticed that baby boomers are really impacted. So regardless of any risk they could find. Anyone born from 1945 to 1965 has higher rates of Hep C. And so we just want to encourage that age group to ask their doctors to get tested for Hep C as well. So lots of things happening in Hawaii, and lots of communities who can really use a little bit of that empowering, a little bit more of that access to resources. So that's what we're trying to do, really empower our communities.
Yeah.
Yeah.
Oh, that's awesome. Now, how can people get tested then for hepatitis?
Well, we do have some resources available for free testing. One of the things that I wanted to mention, though, is that we do think it's really important, again, access to testing and resources, but also raising awareness about hepatitis. And some exciting things have developed recently where national organizations and local coalitions have created public service announcements to kind of get the conversation started. If you don't mind, we have some clips that we brought with us.
Oh, no. So can you just describe a little bit about the clips that we have?
Yeah, so one is a national one from the CDC, just talking about the baby boomers, like I said. So really trying to encourage that age group to be self-advocates, to really ask their doctors to get tested. And the other one is really one created by Hep Free Hawaii. It's a local coalition to just get the conversation started about hepatitis. So it's a little bit more local, a little bit more humor. I like it a little bit more too. So
great. Anything to encourage, empower, I think residents to have more knowledge. So let's go take a look at the PSAs right now.
Did you know that more than 3 million people in the U.S. are living with chronic hepatitis C? But as many as 75% don't know they're infected? Hepatitis C can affect anyone, but those born from 1945 through 1965 have the highest rates of this disease, and many don't know how or when they got infected. So what is hepatitis C? It's a serious liver disease caused by the hepatitis C virus. Many people can live with hepatitis C for decades without ever having symptoms or feeling sick. But over time, chronic hepatitis C can lead to severe health problems, including liver damage and liver failure. In fact, hepatitis C is a leading cause of liver cancer. In the past, hepatitis C was not typically included in routine blood tests. But if you were born from 1945 through 1965, the CDC now recommends that you get a blood test for hepatitis C as part of your standard medical care. Getting tested is the only way to know if you have hepatitis C, so talk to your doctor and find out if you have hepatitis C. It could save your life. No more.
Hey, Uncle Raja, I like to ask you what's hepatitis.
Oh, good thing you asked me, because I just learned about them. We get the highest rate of liver cancer in the nation right here in Hawaii.
For reals?
Oh yeah, Hep B and C are viral infections that attack the liver and can cause serious, chronic, and even life-threatening liver disease.
Nah, how you get them?
Things like needle sticks, unprotected sex, tattoos, and even body piercings can put you at risk. And more worse, Asians, Native Hawaiians, and other Pacific Islanders tend to have Hep B at a higher rate.
Shoots, sounds like people are shame. Is there a test?
No shame in taking care. Get one test for both kind. The good news is that get treatment for Hep B and even one cure for some people with Hep C. Get safe, effective vaccine that can even prevent Hep B. Remember, it's not who you are, it's what you do.
Roger that, Uncle Raja.
This public service message brought to you by Hep Free Hawaii. Go to Hep Free Hawaii's website today to learn more.
Well, those are great, I think, informational public service announcements to get folks to go out and maybe break the stigma and just to find out, because knowledge is power, right?
Yes, yes, always.
So what are specifically some, I guess, activities for testing or how folks can get tested for hepatitis?
We have a lot of great resources for free testing. One of the exciting things is that every year we really push this awareness, and we have a National Testing Day event. So May 19th every year is National Testing Day, and we usually celebrate the week before by encouraging people to go out and get tested either with their doctor or one of the free sites that we list. So people can always reach out to Department of Health or Hep Free Hawaii to find out where some of those sites may be.
Okay.
Yeah.
That's
so,
good.
Yeah.
Would that be on the website?
It'll be on the website, and we'll probably be doing a lot of press, including this, so thank you for that, to encourage people just to know their status, to know if they have it, how they can protect themselves, how they can go to their doctor, and if they don't have it, how they can protect themselves.
Yes. And so what other precautions, I guess, or treatments, you mentioned how people can protect themselves. So what other precautions or treatments can people do, I guess, or needed to prevent hepatitis?
Well, an easy one for Hep B is just to get vaccinated. You know, it's 3 shots over 6 months. There's no side effects really, and you're pretty much set for life. You never have to rebooster or anything. So an easy way to protect yourself for life. For Hep C, it's really just reduce exposure to blood, or if you are a baby boomer, get tested so at least you can know for sure if you have it or not. Because really, hepatitis takes a long time to develop into that liver cancer that I mentioned. So if you can catch it early, you can make sure that you can get medicine, or you can take care of your liver before it becomes something worse. So really, early knowledge is power also.
Yes,
Yeah.
very much so. So we've got the annual testing. What other activities or projects is the Department of Health conducting, I guess, to monitor and prevent hepatitis?
Well, we're doing a ton of stuff. We have stuff going on all the time.
Oh, this one-man team is quite active.
I am
then.
pretty amazing, thank you. Well, you know, and it does come from my passion for this, because I really do believe that communities can be empowered to take care of their own health. So one of the things we do offer, again, is like the testing, so National Testing Day. Free testing, just so people can know their status, or at least raise awareness about that. Other things we do is we work with communities a lot to write grants, for example. We recently got a grant from the Kaiser Foundation to create really again, empower communities and help them to talk about it among themselves. Really, so Department of Health doesn't always have to come in, but we can help provide the resources. We worked with a lot of Pacific Islander communities and Asian communities to create in-language materials that they developed themselves about hepatitis, which is really exciting. So we came in, we had them talk story and tell us how they wanted to present the messages to their own community. And then we were able to print up little postcards to have them distribute and and talk about the conversation. So that was really an inspiring moment, I think, for us, is you know, rather than intervening, having the community intervene for themselves. So some of the other things we've done are really working to build coalitions. You know, a lot of stuff with Department of Health is very bureaucratic. So sometimes we want to empower the community so they don't have to go through us. They don't have to deal with the bureaucracy. So we built coalitions. One of the great successes of the past years was Hep Free Hawaii, like I mentioned before. So really, it's a coalition of community stakeholders who are invested in this, and they drive the coalition and make sure that things get done, that awareness campaigns happen, and it really comes from a grassroots level, which is really exciting, and we're involved with that too. So I just think it's a really great time for the community and for partnerships. So so that's some of the stuff we do.
Thank you for giving us a little flavor
sure.
then.
Yeah.
Now, if you had, I think, maybe like a 30-second I don't know, elevator speech about the most important thing to say about hepatitis, what do you think that 30 minutes or 30-second speech would include?
Okay, I'm glad it's 30 seconds, not 30 minutes. But I could talk about it for 30 minutes. 30 seconds about hepatitis. I would say hepatitis affects people in Hawaii, and that if you are concerned, you should know your status. And 4 easy things you can do. Get tested to know your status, get vaccinated if you want to get protected, get to a doctor if you have it, and then talk about it. Just really reduce the stigma, just like we're doing now. Like, I love to talk, as you can tell, right? Just having people engage and talk about it, because it does impact our communities. Like I said, hepatitis takes a long time to show up. So if we think about our aunties, our uncles, our grandmas, grandpas, people that we know and love, baby boomers, like I mentioned for Hep C, people who were born in Asia Pacific Island for Hep B, these are communities and people that we know and love. And just by talking to them about it and encouraging them to get tested, we are already saving their lives. To share, like on a personal note, I have had family members pass away from hepatitis B because they were too ashamed to talk about it until it was too late. Yeah, so it impacts a lot of our communities, and I think this is a chance for us to kind of reduce the silence and really make our voices heard and empower each other. So, That was longer than 30 seconds, I think. I'm
No,
sorry.
no, but it's like, I think you could probably say it in 30 seconds and have those core concepts.
yeah. I'll break it down next time.
Now, if for the viewers out there, if they hear us, or when they hear this information, they want to hear a little bit more, or they want to read a little bit more,
Yeah.
where could they go and get more information about hepatitis?
The best resource I would say for Hawaii is hepfreehawaii.org. So again, it's that coalition. I work with them closely, so I give them a lot of resources too. And really, the intention of the website is to consolidate all the resources nationally and locally so people can go there and find out everything they need to know about hepatitis. So yeah, really wonderful.
Awesome. Thank you so much.
Thank you.
You've been just a fountain of useful resource
I'm gushing.
about hepatitis. And at this point, I'd like to just kind of ask what other tips might you have, or not tips, but information might you want to add to what you've already shared?
I think just on a personal note, in terms of hepatitis, I really think it is a community concern. And I think that by partnering with each other, by reaching out to community members, by really thinking about this as a way of keeping communities healthy, that we're addressing hepatitis. So anything that we can do where you feel you can help communities that don't always have that voice, that don't always get to break that silence, I think you're already doing work for hepatitis. So again, get tested, get vaccinated, get treated if you need it, and then no shame, just talk about it.
Yeah.
So
Great. Well, thank you so much for taking time again out of your schedule to come and, talk to us and share this information with our viewers.
yes, of course.
Well, I
Thank you.
hope that next time that we have an opportunity, you might share some additional information about hepatitis as well.
Of course, I'll always come back. Thank you.
Again, everyone, thank you for joining us for this episode of Foundations for Healthy Generations. My name is Lynn Salamanca. We look forward to seeing you again at the next episode. Be well, and ahui ho.
Gotta get up. It's a beautiful day. Lucky that we live Hawaii.
24/7, 365.
Swimming in the ocean anytime.